All right. Okay, I'm gonna. So everyone knows a cancer survivor. No one knows an Alzheimer's disease survivor. I'm happy to note, folks, that that is simply no longer true. And I will be making some more statements here that some of you might have questions with. So this is a trigger warning that the field of dementia and brain health have changed dramatically, and there are some new things that your doctor may not be telling you or your clients, which I believe are critical to your understanding how to take control of your health. And some of the topics I will be discussing are in front of you. So we're basically talking about some basic things, how dementia develops, what we now know, and some challenges, like I said, to conventional beliefs. And I believe that these challenges must be made if we're going to, shall we say, flatten the curve and avoid this tsunami of not just dementia and Alzheimer's disease, but also other conditions like Parkinson's disease, strokes, because they are on the rise significantly. A few other statistics I just want to show right now or share. I was shocked when I saw this in medical school, growing up in medical school back in Africa. Dementia used to be considered the very rare condition, and it was a disease that struck the very, very, very old and decrepit white person with people in their 90s and above. Now we're seeing people in their 40s, and interestingly enough, it's hitting Black people more than white people. So a lot of things have changed since I went to medical school. The one that strikes that shocks people the most is number 5 here. It says Baltimore City and Maryland are number 1 in terms of rates. We have the highest rates of any county or state in the country. That's terrifying. And just so we have an idea of what dementia and Alzheimer's disease are, we're just going to start with the basics. The normal brain is to your left. I hope I got this right this time, Deborah. And the abnormal brain is to the right. Okay. It's an actual loss of brain tissue. It's not a psychiatric condition. They're not trying to get you. It is an actual loss, significant loss of over 30% of the total brain mass that is lost in full-blown dementia. Now, with age, there's about maybe in your 80s and 90s, we're looking at a 10% loss. So 30% loss is significantly worse than a 10% loss. So your mission, folks, and this is the mission for you and really for your clients as well, because I understand a lot of you have clients who you advise. Your mission is to keep, should I say it? I probably shouldn't. Okay, I'll just go ahead and say it. Your mission, should you choose to accept it, I know it sounds really corny, but is to keep from going from brain A on the left to brain B on the right. And there's a lot that you can do. Now, my mission really is to help you provide you with the education and the tools you need to do to be able to do just that. So let's talk some basic things. Alzheimer's disease, really, when it comes really right down to it, and I treat a lot of patients with dementia and other brain disorders, but Alzheimer's disease is really the
If you
brain
need me for the
insane.
MRI thing, just let me know.
I will.
Okay.
I'm trying to find the phone. Just to pop it back in now.
Okay.
Right. If everyone can mute their phones, I'd appreciate it. Thank you. Or screens, rather.
So Alzheimer's disease is, in its essence, the brain saying enough. And it's basically backing off. It's basically pruning. It's basically a good analogy would be hibernating. It's basically shutting down and focusing more on vital processes in the brain and body that it needs to control. Again, Alzheimer's disease is basically the brain shutting itself down as a result of several factors that we shall discuss further on. Now, this is a little different from what we've been told and what we were trained in medical school. And of course, what probably doctors are telling their patients today. So I'll tell you how I got to this point. And those who understand what I just explained, or just or the statement I just made, are those who are really getting success in treating and hopefully preventing dementia in their patients and clients. Those who don't are simply treating it the way the standard conventional way is. And unfortunately, we are not getting results because the standard dogma is that there is no treatment or cure for dementia or Alzheimer's disease. We're going to say a few things that might challenge that. So just a few things about myself. I run a foundation and a clinic back in Africa, Nigeria to be exact. And a long time ago, about 10 years ago, we decided we're going to set up one day, or set apart one day exclusively for low-income kids, low-income community, people from low-income community, especially kids below the age of 18 who had severe brain disorders. Now, at that time and up to this time, there was no access for these kids to imaging studies. There were no access to lab tests. There were no medications really to treat things like cerebral palsy or Down syndrome. Maybe some supportive help, but in terms of actually treating and reversing the damage that had happened in their brains, there was nothing like that, and there was no way, like I said, to monitor this. So we had to figure out a way to help these kids that would not harm them, but would be practical. In other words, it would work quickly. If it didn't work within 2 weeks, the parents would not come back. It had to be simple. Most of these people, like I said, were from low income. They were uneducated for the most part. Literacy is still very low in Nigeria. So we had to make it as simple as possible, but most importantly, it had to be safe. I mean, these kids were already having severe brain damage. They were medically fragile in many ways. And so we did not want to add to the burden. And so the only thing we found that worked were nutrients, specific nutrients for the brain. And there's another term that's called nutraceuticals, which is like a midway between pharmaceuticals and nutrients. So if we had to discover nutrients that would specifically help to target specific parts of the brain and would help to nourish parts of the brain so the brain recovered by itself. There were no medications at all because, like I said, there aren't any medications. And so for years, like I said, we had weekly clinics where parents would come from all over this, and they would bring their children from all over the city. And we would sit down and talk to them. We would find out, we'd take videos. They gave us permission to take videos, and we would provide them with these nutrients. And that's over a period of time, we learned a lot. Many times, if I got stuck, I would travel. I would hop on a plane, fly to the U.S., fly around the U.S., learn from inventors, scientists, researchers who are in this field. Basically, go and sit at their feet. And I got to tell you, that's the one thing I love about the U.S. They were so gracious to me. Many gave up their time and their abilities and their efforts because they saw the work that we were doing. So we learned a lot about how to treat brain disorders. And we kind of partnered with the government in doing that. I'm just going to give you one quick example. So one of our patients, I believe one of the very first patients was a young girl, age of 2. She had insulin-dependent diabetes. And so unfortunately, the nurse made a mistake and gave her 100 times, that's right, 100 times the dose of insulin that she should have had. That fried her brain, and somehow she survived, but she was rigid as a board. I mean, she was like really, really stiff. I mean, she could not sit, she could not stand. Her head was pulled backwards. I mean, you felt for her. They had tried everything. They had even taken the kid to the UK and to Dubai. The government sponsored it. So when they came to us, at that time, all we had was this a special brand of omega-3s. And if you don't know, there's a large part of the brain is made up of fat. And a large percentage of that fat is made up of omega-3s specifically. So I figured that, well, I had never come across this kind of condition before. I figured that the best thing, maybe all we could do was just give her them omega-3s. And at that time, I told her to take about a teaspoonful 3 times a day. Well, the mom thought I said a tablespoonful 3 times a day. And she went ahead and gave it. I got to tell you, folks, that was what made the difference. If it had been a teaspoon, it probably would not have worked. The mom comes back into the clinic and she's like, the word she uses is magic. She could not believe it. The kid was not fully back to normal, but that rigidity had almost completely gone. She was smiling, she was laughing, she was happy, all within 2 weeks. And so that struck a chord in me, and I reached out to the manufacturers and I said, do you have any more? This is what we're seeing. They sent us a whole bunch. We began to use them in several different conditions, whether it was cerebral palsy, sickle cell disease. We went to the military hospital, the equivalent of your Walter Reed in the US. We took it there. The psychiatrists and neurologists use it on PTSD, traumatic brain injury, depression. In almost every case, they saw significant improvement. So we thought we had it made. So when people started coming to us with adult conditions like strokes and dementia, I was like, oh yeah, that's fine. We're just going to use the same thing. We found out it didn't work as well because the mechanism of action was different. And so we had to start going back to the drawing board and learning about what it's going to take to address dementia. And that's what I'm going to share with you. And hopefully this will be beneficial. Let's start with some basic definitions. Dementia is an overall umbrella syndrome that it comprises over 100 different kinds of conditions. And it involves basically decline in memory, thinking, behavior, and the ability to perform other activities. Now, you do not have to have memory loss to have dementia. There are several cases. I have a few patients too that simply don't have memory loss. They just have the other conditions. There are about 5 of them here that we've listed. I'm not going to spend too much time here because I think most of you can relate to this or you understand about this. Here's another picture just kind of like encapsulating all of these. And here's another one. Now, Alzheimer's disease, on the other hand, I'm going to give you the standard definition, and then we shall poke a few holes in this definition as we go along. It's also a kind of dementia. It's irreversible, but it's due right here to the abnormal accumulation of amyloid plaques and tau tangles in the brain. Like I said, we'll get into that later on. But bottom line is that most dementia, I know we're seeing it in people in their 40s, but for the most part, dementia starts ages of 65 and above. Anything before 65 is what would be called early onset. So anything after 65 is late onset. Now, let's look at this. The reason why we're talking about age is because that's where it starts. And again, it's really what happens with dementia is an accumulation, a progressive accumulation of injuries or toxins or insults to the brain over a period of time that eventually leads to dementia. Now, I'm just going to quickly go over a few things here. At the age of 25 is when there's full development of the brain. Some people argue that for men, that may be a little later, like after 40, but I'm not going to argue with that too much. 25 is when the part of the brain that makes us human, the prefrontal cortex, the part that is way up in front, just above the eyes. This part has to deal with judgment, planning, impulse control, discipline, and so on. That's what separates us from the animals or the other beasts or the other mammals. At 40 is when things tend to begin to go south for the most part. Memory loss, you begin to notice certain glitches in your memory. You begin to notice maybe eyesight and so on. Menopause is a big thing. I'm going to show you another graph very soon. You probably know this already, but women have twice the rate of dementia as men. One of the reasons for that, not all the reasons, is that excuse me, at menopause is when energy levels begin to drop. So I'm just going to quickly explain this. You see the legend there. So with women, it's in pink, the decline. So at age of 20, but for both men and women, brain energy is about 100%. This is what I'm pointing to brain energy, and I'm going to explain why that is important. But at 100% is about 20%. You can see, I'm sorry, excuse me, at 20 years of age is about 100%, and then kind of begins to decline over time. At the time of menopause, there's a steep decline. Some say as much as 30%. Now, for most people, they tend to recover somewhat, and eventually it stays at age of 90 about 65%. With dementia, we begin to see the symptoms below the age of below 60%. So 65% is just 5% above 60%. This green chart graph here, this green line refers to those who actually have received good standard of care treatment for menopausal symptoms. So that helps to bring things back on track. Most people, unfortunately, do not have that benefit. So the question we have to ask is why energy is so important. And that takes us to how the brain works. We're going to look to the most basic parts of brain function. So on the left side is the brain, on the right side is what is known as a synapse. It's where two brain cells come together. There are over 100 trillion. I don't know who got the time to count them, but we're just going to take their word for it, right? There are about 100 trillion synapses. And basically anything that happens in the brain, most things, whether it's reading, writing, you're listening to me, you're hearing words, you're making those words make meaning in your brain, you are moving, you are seeing, you're sleeping, everything, almost everything has to happen at this level. There has to be two brain cells coming together to pass information. If that doesn't happen, your brain is going to suffer to some degree or the other. It's happening all the time. New cells are coming together. Other probably some connections that don't serve you will be removed or pruned away. It's for the brain to remain healthy. This continuous motion is like a firestorm. It's a volcano, eruptive activity. It's constantly happening. By the time this presentation is over, your brain will not be the same as it was when you first started this presentation. And this network has to be maintained by energy. And the numbers are over 60%, some say as high as 80% of the brain's entire energy supply is used to maintain this network. So you're seeing where I'm going now. If energy is not adequate, the network to some degree or the other will fail. And usually it's in the parts where the network or where the connections are densest or most frequent. And I'm going to show you that in a minute. Okay, let me just ask this question first. What happens when that ability is hobbled by insufficient or inadequate energy supply? People use the term brain farts, and some of you may, I guess everybody can relate to that. You're tired, you're stressed out, you end up not doing what you think you should be doing. And other terms like glitches, wires crossing, problems forming new memories, problems remembering things. This happens to when we're stressed. I remember I went to the gas station and I was supposed to put in my zip code, and I could not for the life of me remember what my zip code was. I've used my zip code millions of times. Anyway, after a while, like, it came back to me, and I was like, okay, danger averted. But I never forgot that. So here are a few things. When these are early signs, they could be early signs of dementia, but there sure are early signs of energy loss in the brain. other examples are difficulty following a conversation. Now, there's a psychiatrist, a friend I know. She had early dementia, and the main thing that stood out to her was that she couldn't follow a conversation. She would go for lunch with her friends, and she couldn't follow what they were saying, and she thought she had problems hearing. So she did an audiology test, perfect hearing. Later on, found out that it was early onset dementia, and she found out people who were treating dementia. She found out how to treat herself, and now her whole life has been transformed, and she's now focused on treating dementia. She's still a psychiatrist, yes. Another example is asking the same question over and over and over again. Sometimes it's not that they didn't hear you the first time. Sometimes it's that they didn't understand you, or they did not, or sometimes they forgot they even asked the question in the first place. And that can be very, very frustrating, I understand, for caregivers. Not to overflog this topic, is so important that the brain has enough energy to maintain its synapses. If it does not, it's going to begin to ration things out. It's going to start focusing and giving more priority to the parts of the brain that are more important. And I asked this question at a meeting, a presentation I gave. I asked them, what is more important? Your brain remembering how to breathe, or your brain remembering your spouse's birthday? And I thought that was an easy layup. And I noticed that nobody answered the question. And then I noticed the men were shifting uneasily on their seats. And then finally, someone in front says, could correct me up. I was like, man, okay, I'll move on. Basically, as far as they're concerned, they were one and the same fates. Forgetting to breathe and forgetting your spouse's birthday, you still end up in the same place. Okay, so let's look at what the statistics or the studies show, that this drop in energy happens decades before. So dementia doesn't jump on you in your 60s. Some are saying as early as in the 20s, the signs are beginning to show, if you know what to look for in the brain. That's why this is so important for us to understand this, so we understand how to, one, prevent this loss of energy, and number two, know how to boost energy levels in the brain. So question is, what drains my brain's energy levels? I came up with this list of about 12 items. I called it Dementia's Dirty Dozen, and I have an ebook to that effect. Here they are. I'm just going to use a story to kind of illustrate my point. If you have any questions about any of these, you can type it in the comment section so we can go over it. I'm going to use one example. You may know about this person. So this person is a little on the older side. He has had a history of, well, they have had a history of stroke, 2 brain surgeries for an aneurysm in the brain. He's had all right, he's a he. He's had problems with stomach ulcers, so GERD, reflux disease. So he's been on treatment for that. Later on, he had a severe bout of COVID, and later on, earlier in his career, he lost his wife and daughter to a major traffic accident, and then later on, his first son to cancer, and then he had troubles with his younger son, dealing with drugs and so on. He's recently been diagnosed with cancer. I guess somebody knows who I'm talking about now. And on top of all that, he has the most stressful job in the world. Probably some would argue most stressful job in the world. When that debate happened, some of us were asking, how did it take this long? Because any normal human facing all this and having to be treated for all this has had severe, and when I say severe, I mean the brain has suffered a lot of assaults over a period of time. It's unthinkable, really. That's anyone be able to survive for that long uh, such a stressful position. So I guess everybody knows who I'm talking about. I have this picture here because I was shocked to see this too myself, that isolation, if you notice in the Dementia's Dirty Dozen, is one of the reasons why people can eventually have dementia. And they've shown how defects in human relationships or loneliness can lead to actual shrinkage of the brain. So it's very important. What else? So we've talked about energy levels being low and the networks needing to be maintained. And if the energy levels are low, certain defects will show up. What else do you think shows up? Here's what we're finding out, that because energy levels are low, and one of the functions of the brain, especially during sleep, is to clean up or clean out, take away toxins, break down unnecessary proteins or harmful proteins, and remove proteins. If you don't have enough energy in your brain, you will not be able to do that effectively. And one of the proteins that build up as a result of that are the amyloid plaques. You've all probably heard of that before. So back to our definition. The definition is that it is due to the abnormal accumulation of amyloid beta plaques and tau tangles in the brain. So the question now is, and this is the emergent science, folks. So please don't attack me. I know you probably heard something different from your doctor, but this is the truth. The emergent science is that we're beginning to question whether the plaques occur because of the things that have happened, like energy loss, damage, as opposed to are they actually the ones driving the dementia? What's the dogma today is that the plaques are driving the dementia. The recent research is saying that it's probably the opposite.
Dr. David, we have a question that's come in. So can you define what insults means in this context?
Yes, I always get that question. So insults refer to things like toxins, chemical toxins, air pollution, toxins in your teeth. I wanted to say infections, but that's another one entirely. So insults just refer to the whole, basically chemical toxins, mold in the house, like I said, air pollution, toxins in our food, big deal there. A lot of pesticides and a lot of other things, artificial flavorings and other things that are added to our food that simply shouldn't be there. In other countries, they are banned. In this country, many of them are allowed. So I hope that answers the question. Are we good?
Thank you. Appreciate that.
Sure thing. So we need to take a close, hard look at our current approach to dementia. The drugs that are being made, and I say this with fear and trembling. I am a doctor. I'm licensed, and I have to abide by the rules. But the questions must be asked. The whole focus now, because of the definition of dementia or the understanding of dementia, the whole focus is on removing those plaques. And that's why you're having this multi-billion-dollar research. And unfortunately, many of these approaches have failed, but they're still staying with it. And the most recent drug, we're still waiting for the answers. We're still waiting to see. It's called Leqembi. We're still waiting to see. There hasn't been any conclusive evidence that, now it works, don't get me wrong. It removes the plaques, it removes the proteins. But with the removal of the proteins, they have not been able to show convincingly and conclusively that there's a restoration of brain function. In fact, in some cases, they remove the plaques so effectively that in about 30% of these patients, there's brain swelling and brain bleeds, because sometimes yanking and tearing away the proteins from the surface of the brain or within the brain structure can cause brain bleeds. So removal of the plaques does not necessarily mean that brain function is restored. Nobody would argue with that. And it's really concerning to me because coming from a third world country, we're now beginning to see a significant rise in dementia and other brain disorders. And so we are looking to the West, we are looking to the US, we are looking to you to provide solutions that we can use and apply in our third world countries where we don't have like $56,000, for instance, or we don't have adequate insurance to pay for these kind of medications. And I'm hoping that we can get it right. And I'm hoping that what we're doing with these presentations too can also keep the conversation going. In the US, I was shocked. Last time I checked, it was about 300 billion. Now we're seeing it's about 781 billion just for dementia costs. And it's significantly higher per individual too. So it's getting worse and worse and worse. And the numbers are not, the forecasts are not favorable either. We're talking about doubling of cases in the next few decades. And it affects Black Americans, they're going to triple. So this is not looking good at all, folks. I have this picture here because these are the three demographics, the three main demographics that have dementia twice as bad or have twice the rate of dementia as the rest of the population. The veterans, Blacks, and of course, women. Because I belong to two of these, I'm especially concerned. And just for clarification's sake, I mean the fact that I'm a veteran and that I'm Black. So let's talk about what the solution is, in our opinion. And there's a growing body of healthcare professionals like me who are beginning to treat and treat based on this newer understanding. It cannot be one drug. I don't know why we're so focused on one drug. It cannot be. Now, a drug will help for sure, but you've also got to talk about you've got to think about how to heal, how to repair, how to aid the brain in snapping out of its hibernation mode, its self-protective mode, the mode where it's kind of shuts down, and maybe coax it, encourage it to bloom again, like the way a flower does to the sunshine. That's really what we're talking about, folks. We're talking about encouraging the brain to heal itself and to express itself. And the only way you do that, the first way you do that is by restoring energy supply. So, and this, as we mentioned earlier, is that when we talked about your mission, this lies in your hands. It lies in your client's hands. It lies in the hands of every responsible individual. Everybody must understand what it takes to keep their brains healthy, to avoid damage to their brains, but also to know the things that strengthen and encourage the brain to flourish. We can't go into all that right now, but here's what we've been doing. So I have a course that I make available to clients and patients called Keeping Your Marbles. And basically, there are three things that we emphasize. You got to know what harms your brain, you got to know what helps your brain, and you got to keep track of the numbers, because these are the things that cause people to have dementia. And just think of your brain like a fortress. It's got the security, the walls, you got the moats to keep out intruders. The economic activities happen within the walls. Your job is to ensure that the people or what is inside the walls are safe and allowed to flourish. And the way you do that is by, this first picture shows what happens when there's dementia, what causes dementia. So on the left side, you have all these arrows showing attacks, insults, and so on the brain, causing it to shrink. On the right side is have the yellow arrows, the things that help to nourish and strengthen the brain. As you can see, there's more of the red than more of the green. The goal is to reverse that and make it more of the green and less of the red. And you absolutely can do that. And the first thing is to reduce. I'm just going to take a few examples, just one example really of each, because we've run out of time. Number one is sugar. Your body does not like too much sugar. After a meal, 2 hours after a meal, it brings sugar levels down, or it tries to bring sugar levels down to less than a teaspoon. Less than a teaspoon, folks, is what your body is comfortable with. Your brain does not like too much sugar. So once it gets higher than that, and it stays higher than that, it causes all kinds of problems. It's not just about diabetes. By the way, diabetics have about twice the risk of dementia than the rest of the population too. Number two, you've got to strengthen your defenses. There are certain defenses that your brain already has in place that protect it, include from invaders, from attacks, including it has its own specialized immune system. So we need to understand how to do what it takes to strengthen that immune system. And one of the things is, we got this from an Alzheimer's study. Does anybody know? Okay, the study said that over 40% of dementia risk. Okay, let me put it this way. Excuse me. I'm looking at the time because I'm like, okay, I got to finish up. Your risk of dementia can be reduced by over 40% if you have one single nutrient. If your body has enough levels of that one single nutrient. Does anybody know what nutrient that could possibly be? I'm just going to quickly show. If you know it, just quickly type in here. I'll check it real quick. I want to have a feel for what folks know. If you know what that single nutrient is, that if you have enough of in your body, would reduce your risk of dementia by as much as 40%.
Water.
I'm sorry? Somebody said, does it say water? Okay, I'm just going to go ahead and tell you. It's vitamin D. Vitamin D3, yes, that same vitamin you can get out in the sun. But this study specifically looked at those who supplemented, not those who went out in the sun, but those who supplemented. And they said this protective effect was more. So I said 40%. They said for women, it's about a 50% reduction in risk of people who supplement. So my question is, and you think with me, if there are about close to 200 different kinds of nutrients that our bodies need, one single nutrient, vitamin D, can help in dementia and brain health. Could there possibly be other nutrients? I mean, if we were really, really serious about stopping dementia and stopping Alzheimer's disease, wouldn't it be a great idea to actually look at these others? Besides, doesn't everybody know this? Why isn't it being shouted from the rooftops that this vitamin D helps? I mean, if we are really, really serious about ending dementia or reducing the dementia, shouldn't this be widely known? Shouldn't every neurologist be talking about this? Never mind. So sleep I won't talk about sleep, but sleep is a very important thing. Some of the numbers that you want to look at, I recommend about 7 different tests that can be done in most hospitals. They don't need the fancy gadgets to do them because, like I said, I think third world country. I think poor. So I always think in terms of what are the basic things. Now, these basic tests you can use as a surrogate to really get an idea for what your brain, the status of your brain. Now, some of them, I'm going to mention 3 here. Tests for blood sugar, the different kinds, tests for insulin levels, and these both have to be fasting levels of blood sugar and insulin, and of course vitamin D3 levels, very important. The range is 30 to 100. The closer you are to 100, in my opinion, and in the opinion of several doctors who are in this space, the better it will be for you. We also recommend vitamin K2 because they work together, and magnesium. So magnesium, vitamin K2, and vitamin D work together, but vitamin D is probably the most important. So for those who already have the disease, I was discussing this with Deborah, and she said, we can talk about what we do. So my clinic and my foundation, this is our approach towards treating dementia. Number one, obviously, we got to focus on restoring brain energy. That's right there at the top, green. Blood flow. Most 80% and above of dementias have a cardiovascular disease component as well, which means that the blood supply to and through the brain is inadequate. So we need to boost that. Other things we focus on are gut health and detoxification and so on. But I look at the person's, so what I do is I look at the person's records. I maybe talk to their doctor or the primary care doctor, try to figure out how they came to this point. And then based on their sex, their age, and so on, we now create a plan for them that helps. I have a quick testimonial from a patient I'm currently treating in Nigeria now, the really advanced stage. She could not feed herself. Number one, the global cerebral cortical atrophy. The word that you need to pay attention to is atrophy. The brain had shrunk. So it was in a really bad state. I was wondering, why did you take so long to reach out? Because apparently the person knew about me before. Anyway, bottom line was that we got the supplements and the nutrients and the nutraceuticals, and we shipped them to Nigeria. And I gotta tell you, within not even up to a week, we began to see results. She was able to feed herself. She was able to recognize her grandkids. She's now walking with support. She was almost completely bedridden. And the point we're trying to make here is that if you know the brain has the capacity to heal itself, and I know I've said this before, your brain has the capacity to heal and repair itself. It just requires the tools. It requires the resources to do its work. You give it what it needs and you stand back and it's going to do the work. Many times, even with treatments of other brain disorders, I feel that they are missing out, the neurologists, rather than just focusing only on medications. They should add the things that will help to nourish the brain back to health. The combination, in my opinion, is a winner. So these are the consultation. I mean, like I said, we discussed this with Deborah. Consultation is, I charge about $250, and then on a monthly basis, retainership, where I basically hold the person's hand and we get the medication, I keep saying medications, they're not medications, the nutrients. I usually try to get it for them because they're a whole bunch, and we basically titrate the dose as we go along, and we teach them how to use it. We get feedback. We meet every week, either over the phone or virtually, and we basically walk them through and guide them through the process, because this really takes a lot. It's like your brain is in the ICU, and I'm the nurse, the ICU nurse, and basically administering the medications. It's an ongoing thing. Just again, it's about nursing the brain back to health. There's a lot of research. I have a code here, QR codes, to back everything I've said, where you can actually see the references. Yeah. So let's bring it all together. Back to your mission is to keep your brain normal and healthy to your 90s and above. You want the first place to start is with ensuring that your brain energy levels are optimal. So you want to go from this to this. And would really appreciate you if you could help us get the word out. It is my mission to help people understand this and how to take control of their brains. I'm happy to speak at any setting, college, even colleges. I think we need to start with colleges, really, all the way to senior centers. And that's my information over there. And with that, I will say thank you for listening. Again, thank you, Kerry, and the team for having me, and Deborah again for making the connection. We'll hand this back. Thank you again. Bye.
Thank you.
So Dr. David, thank you so much for being with us today. We really appreciate your participation and insights regarding dementia and Alzheimer's and so many things going on with brain activity today, especially with aging populations. There are some questions that came in the queue, and I was actually involved in one of these. So I wanted to just briefly mention that you talked about the Dirty Dozen. And one of the things I thought was interesting that it wasn't in the Dirty Dozen is excessive alcohol use, excessive drug use. For example, a rise in non-prescribed marijuana use now in our culture, especially regarding young people, and also smoking. So can you just give us your thoughts about those three items, a reduction of those or change in modification of behaviors, and how that affects brain health?
Great question. Thanks, Ed. Yes. So just the rules were they had to start with the letter I. Okay. So that, if you notice, they all started the Dirty Dozen. They all start with the letter I, just to keep it cute and funny. But yes, smoking, alcohol, vaping included, and of course drugs, whether recreational or actual prescribed legal drugs, they all fall under the category of insults. So it could be intoxication. That would be another. I created the word intoxication. Yeah, smoking. Did you want me to say specifically how these can damage the brain, or just wanted me to make sure I mentioned them?
No, we're just making sure that saying that they're under the insults category is very helpful. You know, one of the things I'm grappling with, we have a new generation of younger people who are using high volumes of marijuana. Okay, so that might be not affecting them at 20 and 25 and 30, but it's going to seriously affect them at 20, 55 and 60 and so on and so forth. I'm really concerned about younger people in the population, the long-term effects of some of these drugs that are on the market, not on the market, on the streets, whatever it's going to be. And I'm very hopeful that there's targeted effects and outreach to young people regarding some of the long-term capacities and issues regarding these drug uses as well. So I just wanted to chat about that. So.
Yeah, you have every right to be concerned. That is it's a big problem. I mean, even for those in their 20s, they are beginning to show with the scans, they're going to begin to show problems in the memory centers and the judgment centers, even for those who are just recreational, just casual users. So it's a big problem.
We had another question that came in. It says, also wondering if there have been any studies about the impact of social media usage in dementia and Alzheimer's. And isolation may be reduced potentially, but possibly other side effects. So what are your thoughts about that?
Correct. Well, so social media, yeah, that's another thing. That's a mental health category. So I included that under illnesses. So mental health. I'm not saying it's a complete illness in itself. So what makes the brain healthy and strong is when it's working hard, when it's thinking, when it's reading, when it's figuring things out. If it's passive, it's just doom scrolling. Or just watching TV, another example, and that's for those of us in the 70s and 80s, just watching TV. These are things that weaken the brain. They don't help in the formation of synapses, for example. They increase distractibility. They don't help to form discipline. So all of those things cause weaknesses and therefore increase vulnerability to certain conditions when they strike, like loss of a loved one or a brain injury, for instance. Those who already had built strength in their brains by working the brains hard prior to the event are those who tend to recover more quickly and more completely.
Thank you. Other questions from the audience. I also want to remind everyone to please put your name and email address in the chat so you be sure and get credit for CE. That has been approved for this presentation. So any other questions from the audience regarding the presentation? And Dr. David, let's take advantage of his presence here to ask questions about dementia.
Super helpful presentation. I don't have any questions, but it's just been really, really worthwhile. Thank you.
Thank you.
All right. Well, Dr. David, thank you so much for being with us. We have your contact information. It's been a pleasure to meet you and hear your words of knowledge and wisdom and sharing your passion with us regarding dementia care and what we can do to better our lives and those of our clients. So I really appreciate that. As a reminder to everyone, we have upcoming meetings in August and September. In August, we have Sherry Rush, who's going to be talking about Medicaid. And then in September, we have Elaine Phelps, who's going to be talking about Medicare. So I want to say hats off again to Deborah for bringing our wonderful speakers to us. And I will also say, if you have a particular presentation or speaker that you would like to hear and share with the larger audience in October, November, December, and into 2026, please let me know. Ed Peterman, ed@trustedchampions.com. Just send me a note and we can talk about potential speakers going forward. Anything else we would like to chat about today for in this collective audience? I'm so excited to have such a large number of attendees today for this presentation. Anything else we need to chat about while we're together? I encourage everyone to go to the conference in August in Baltimore for the CSA. It's always a great opportunity to learn new things, to talk about new events coming through, and just meet new people in the audience from CSAs around the country. It's really an exciting event, so I encourage everyone to attend. If you haven't registered, please do so. All right. If not, Deborah, thank you again for bringing a presentation today.
You're welcome. I hope everybody enjoyed it. He is available to do other speaking engagements, so keep him in mind as well. I kind of coordinate his schedule for him because he's very busy. So just reach out to me if you have any thoughts or you're thinking of doing something that he could be your guest speaker. Feel free to reach out to me and I'll check with his schedule.
Great. Thank you again. Thank you all for being here. Great presentation, and we're stopping right at the top of the hour.
Bye, everybody. See you next month.
Bye.